Good morning, everyone. My name is Dr. Pallavi and I'm working in KLS Wellness. Today I will talk about ozone therapy in gynecology. What is ozone? Oxygen is O3 and ozone is O3. What is medical ozone? Medical ozone is a mixture of pure ozone and pure oxygen, 0.05% to max 5% O3. Ozone breaks into an oxygen molecule and a single active oxygen atom in about 20 minutes. Ozone quickly combines with blood, lymph and other tissues of body and purifies them. What are the biological properties of ozone? It improves oxygen metabolism, it regulates oxidative stress, it regulates prostaglandin levels, it helps in immunodulation, it has a wide spectrum of germicidal properties. It has a good metabolic regulator. What are the benefits of ozone therapy? It improves oxygenation of good red blood cells. It makes cells more healthy. It has better intake of nutrients. It improves elimination of waste products, toxins, and harmful free radicals. It improves circulation, it improves immune system. Thus, ozone therapy increases energy level in body and leads to anti-aging effects. What are ozone therapy in beneficially in the following conditions? Cancer support, cardiovascular disease, autoimmune disorders, anti-aging, Parkinson's disease, asthma, pain management, diabetic foot, kidney disorders, infections and arthritis. What are the conditions treated in women? In cases of inflammatory conditions, endometriosis, infertility, inflammatory disease of lower female genital organs. It also helps in autoimmune disorders, autoimmune miscarriage, endometriosis, infertility due to autoimmune disorders. In more conditions, placenta vascular insufficiency, prevention and treatment of intrauterine fetal infection, vaginal fungal infection, candidiasis, vaginitis, genital cancer and PCOD. What should be precautions taken? It not recommended during menstrual cycles or during any type of bleeding in the body. Ozone dosing. Low dose is 2500 to 4000 microgram. It's an immunomodulatory action. Medium dose is 4000 to 7000 microgram. It's antioxidant action. High dose is 7000 to 15000 microgram. It's a germicidal action. What are the routes of ozone's administration? It's a major autohemotherapy, minor autohemotherapy, ear insufflation, breathing ozone through oil, rectal insufflation, intra and periaortical injections, intravenous ozone saline. Routes of ozone administration for gynecology. Vaginal insufflation for local treatment, vaginal irrigation with ozone water, rectal insufflation, ozonate oil, rapid heal oil application twice a daily. These are the two clinical studies. Ozone therapy in female infertility. Study done in vaginal infection showed elimination of infection in 90 to 100% of cases. This is another study. The treatment of endometriosis in combination with ozone therapy. 15 patients treated showed improvement in overall general state, body temperature turned to normal, sleep and appetite improved, pain syndrome disappeared faster, pathological discharges were eliminated. Our experience, already Dr. Nandini has spoken about this, that we have a Neurogen hospital converted to COVID hospital and we have done this experience in medical ozone in COVID. These are the two studies. One is a moderate state COVID-19 patients and second is in healthcare worker for prevention of COVID. These are the two papers and this is the observations we have seen. We conducted the first CTRI registered clinical trial for use of ozone therapy in COVID-19 patients. No severe adverse events recorded. Patients improved from moderate to mild category in average 8 days. All clinical symptoms resolved within 6 days. Oxygen supplementation required reduced. We also did a study on other use of ozone therapy as a prophylaxis for healthcare workers during COVID pandemic and observed a reduced incidence of acquiring COVID-19 post ozone therapy. Squeeze the bag and then dispense ozone by rolling the bag forward. Never lose the grip from the bag, as there will be backflow of gas from the anus in the bag. Do not leave the grip, it needs to be tightly handled. Gently squeeze the bag so that the whole procedure is finished between 3 to 5 minutes. You can keep asking patient whether he is doing fine. If the patient feels the pressure in the rectum, then you can go slow for dispensing. You can gradually dispense. It will be take 3 to 5 minutes. Mama, ठीक है ना? The patient assurance is very important, that when we are doing gently, and this rolling of the bag is also done gently. Once rectal bag is completely empty, then you can fill this and hold, then clamp so that there is no back pressure. Once this clamp, you can leave the rectal bag, then clip this tube and disconnect the rectal bag. This bag can be used for the same patient for 10 sessions. Gently remove the rectal catheter and tell the patient to dress and lie down straight on the back, and then the procedure is done. Thank you. This is another video. I have talked about the vaginal ozone. Hello, I am Dr. Pallavi and I am specialist in anti-aging and integrative therapies. Today we will discuss about vaginal insufflation. Vaginal insufflation is a localized application of ozone through vagina. It gives antimicrobial results as well as good lymphatic cleansing in women. It can be given for various female-related issues like vaginitis, endometriosis, pelvic inflammatory disease, infertility, PCOD, other reproductive tract pathologies, genital cancer, etc. Before administration of vaginal ozone, the patient should be asked if she is menstruating. If so, then ozone administration should be postponed. Vaginal ozone can be given either through direct link or indirect link. In indirect link, 200 to 400 milliliter can be given at 10-20 micrograms. Patient is asked to remove pants and lie in supine position with knees bent. A10 number infant feeding tube is passed in the vagina up to 4 inches after lubricating it with ozonate oil. The rectal bag with patient name is taken and filled with desired volume and clamped. The tube of the rectal bag is attached to the outside of the infant feeding tube, and the ozone is slowly and gradually administered. After it's done, the infant feeding tube is slowly removed. Through the rotational movement, patient is asked to lie down in the same supine position for few minutes. In direct link, 20 to 30 microgram can be given at 120 ml for 5 to 10 minutes. Here the silicone tube from the outlet of ozonator machine is directly connected to the outside of infant feeding tube. After careful passing it in the vagina, the same way mentioned earlier, the machine is then switched on after carefully adjusting the dose and flow. Ozone is given for the required amount and the machine is switched off.
The infant feeding tube is then removed gently by the rotational movement. The patient is asked to lie down for a few minutes in the same supine position. Post-treatment, the patient may complain of gurgling and passing gases from the vagina or slight cramp-like pain. This is completely okay. You can counsel the patient that it shall go in some time. But if the patient is discomfort or pain is for long lasting and unbearable, then discontinue the procedure. Thank you.
This is the last slide. Ozone, how it helps. Regeneration, increase in energy levels, detoxification, body gets a breath of fresh air, feeling of well-being, improvement in quality of life, control of pain, less infection and faster cure of infections, sometimes even without antibiotics. It's very safe, natural, low-cost complementary therapy. No side effects experienced by the patient as against dreadful side effects of some allopathic drugs, effective for a large variety of illness. Thank you so much.
Thank you, Dr. Pallavi and Dr. Nandini.